We are very aware at GSK that we operate in a very precious space. Healthcare is extremely personal, it's extremely sensitive, and it's an area which fundamentally requires responsibility. This is something that the company takes very seriously. At the core of the company are really two things: innovation and access. And the two are intrinsically linked. And what it really should tell you, I hope, is that we don't see any kind of difference between our commercial success, our shareholder return, and our responsibility in the contribution we should make to society.
On the public level and in the outside world, many people do not even know that within a pharmaceutical company there are many very highly trained physicians and scientists who actually drive business and who are medically thinking about how we can deliver the best medicines to patients. We have created a platform whereby clinical data can be shared, and if we have the data, then we will make it available going forward. We will no longer incentivize sales force based on sales, but rather on the quality of the information and the feedback from physicians on the quality of information. So two examples where I think we have made bold moves in the industry to make sure that the prescribing public and patients have the best and right information to use our medicines.
Our mission is to make more people do more, feel better, live longer, regardless of where they live. Now, Africa is not an easy place to do that. Africa has to deal with half the global burden of disease with just 3% of the global health workforce and just 1% of the global health budget. Clearly why it's not an attractive place for a company like ours. But it's where the greatest need is. Essentially, the ambition now is to be the leading healthcare company in Africa by 2020. We are going to put up 5 new factories across 5 new sub-Saharan African countries. We're going to set up 25 new academic chairs across universities in Africa to train skill sets that Africa needs today. One of the most exciting developments is the development of a malaria vaccine. Malaria still kills at least 500,000 children every year. We still have to go through regulatory approval and get WHO a positive opinion, and if all that goes well, as early as 2016, we will have that vaccine being implemented in African countries.
The work that GSK is doing is very much relevant to a couple of themes that at BSR we think are very important: transparency and transformation. Business has the resources to innovate and to create. Businesses create opportunities, create economic activity, and create the products and services that people need. I think we need more companies like GSK to have a level of ambition to aim high.